The confrontation happened in the parking lot of Whole Foods on a Tuesday afternoon in October, where my sister Vanessa had cornered me between my car and a shopping cart corral. She'd been building up to this moment for weeks, and the fury radiating from her perfectly highlighted hair told me she was finally ready to deliver her verdict on my life choices. "I know what you're doing, Emma," she hissed, her voice low enough to avoid attracting attention from other shoppers but sharp enough to cut. "This whole cancer act needs to stop. It's embarrassing for the entire family." I shifted the weight of my purse, trying to hide how the simple act of grocery shopping had left me exhausted. 6 months into chemotherapy for stage 3 ovarian cancer, even basic tasks felt like climbing mountains. But Vanessa saw my fatigue as performance art. "I've been talking to people," she continued, clearly enjoying her role as family detective. "Nobody's ever seen you at the hospital. Nobody's met these supposed doctors. And you look fine, tired maybe but not cancer sick." The people she'd been talking to included our mutual friends, extended family members, and apparently half of our social circle. For the past 3 months, Vanessa had been conducting what she called fact-checking my diagnosis, spreading doubt about my medical situation like gossip at a book club meeting. "Plus," she added, crossing her arms with the satisfaction of someone delivering a knockout punch, "the timing is awfully convenient. Right when I announce my engagement, suddenly you have this dramatic illness that requires constant attention and sympathy." The timing was convenient if you ignored the fact that I'd discovered the abdominal pain 3 days before her engagement party and had spent her celebration in the emergency room getting my first CT scan. But Vanessa had never been interested in details that complicated her narrative. "Look at you," she gestured at my appearance with obvious disdain. "If you really had cancer, where's the hair loss? Where's the dramatic weight loss? You just look normal." That was her medical assessment of someone wearing a $3,000 wig to hide complete hair loss from chemotherapy, someone who'd lost 25 pounds but disguised it with carefully chosen clothing, someone who applied makeup like war paint every morning to hide the gray pallor that came with aggressive cancer treatment. I'd been funding her engagement expenses for the past 4 months. The venue deposit when her fiancé's financing fell through, the dress alterations when she gained weight from wedding stress, even the photographer when their budget came up short. But supporting her dream wedding apparently didn't buy me the benefit of the doubt when it came to my cancer diagnosis. "Here's what's going to happen," Vanessa announced, clearly relishing her moment of authority. "You're going to admit this whole cancer story is made up, apologize to everyone you've lied to, and get some therapy for whatever psychological issues made you think this was acceptable." The psychological issues had started with discovering I had cancer and had been compounded by months of dealing with a family who'd turned my diagnosis into their personal conspiracy theory. But Vanessa wasn't interested in psychology, she was interested in control. "I've already talked to Mom and Dad," she continued, "and we're all in agreement. This stops now. No more fake hospital visits, no more dramatic symptoms, no more playing victim for attention." The fake hospital visits included twice-weekly chemotherapy sessions, monthly oncologist appointments, quarterly scans, and regular blood work to monitor my treatment response. But Vanessa had never asked to attend any of these appointments, never requested to meet my medical team, never showed interest in understanding my actual treatment protocol. What she didn't know, what none of my family knew, was that my treatment team at University Medical Center included Dr. Sarah Williams, Chief of Gynecologic Oncology and one of the most respected cancer specialists on the West Coast. The same Dr. Williams who'd been featured on the cover of Oncology Today for her innovative treatment protocols. The same Dr. Williams who'd taken a personal interest in my case after learning about the family dynamics affecting my treatment compliance. "You have until Wednesday," Vanessa concluded, checking her phone like she was timing my response. "Wednesday morning you admit the truth or I'm telling everyone myself. I won't let you make our family look stupid with these medical fantasies." Wednesday morning. When I had my regular appointment with Dr. Williams and the entire gynecologic oncology team for treatment planning and psychological support evaluation. "Fine," I said quietly, unlocking my car door. "Wednesday morning you'll get the truth." What Vanessa didn't know was that Dr. Williams had been documenting the family situation in my medical files for months, and she'd recently suggested a family conference to address the psychological stress affecting my treatment outcomes. Wednesday was going to be very educational for everyone involved. Build up, 600 to 800 words. The family campaign against my diagnosis escalated through Tuesday evening and Wednesday morning, with Vanessa mobilizing every relative and family friend in her contact list. She transformed my cancer into a family crisis that required immediate intervention, not for my health but for their reputation. "I've been making calls," she announced during our family group text thread that Tuesday night. "Cousin Beth says she's never heard of anyone having cancer treatments twice a week. Aunt Linda thinks the whole thing sounds suspicious. Even Mrs. Patterson from Mom's Bridge Club says real cancer patients look much sicker." The medical expertise of Cousin Beth, Aunt Linda, and Mrs. Patterson apparently outweighed the diagnostic capabilities of University Medical Center's entire oncology department. But Vanessa had never been one to let facts interfere with a good theory. "Plus," she continued in another text, "I drove by the hospital yesterday during one of Emma's supposed appointments. Didn't see her car anywhere in the parking garage. Very convenient. She'd driven by on Tuesday afternoon when I was actually at the infusion center receiving my weekly chemotherapy, a building that was separate from the main hospital with its own parking facility." But geography, like medical reality, had never been Vanessa's strength. The morning of reckoning arrived with Vanessa showing up at my apartment at 8 a.m., clearly prepared for what she expected to be my public confession and apology. She'd brought Mom as backup, and both women stood in my living room with the satisfied expressions of people about to solve a mystery. "We're here because we love you," Mom began, though her tone suggested otherwise. "Vanessa's shown us how inconsistent your stories have been about these medical appointments. We think you've gotten so deep into this fantasy that you might actually believe it now." Vanessa nodded approvingly at Mom's psychological assessment. "It's okay, Emma. Mental health issues run in families. Dad's anxiety, Mom's depression after the divorce. This is probably just your version of that. But pretending to have cancer isn't the answer." The irony was suffocating. They turned my actual cancer diagnosis into evidence of mental illness, while simultaneously demonstrating a complete disconnect from medical reality that bordered on delusional thinking. But self-awareness had never been a family's strong suit. "Here's what we've decided," Vanessa announced, clearly enjoying her role as family spokesperson. "You're going to call everyone you've told this cancer story to and admit it was a cry for help. Then you're going to see Dr. Morrison. Remember him from church? He's a psychiatrist and he specializes in people who create elaborate medical fantasies." Dr. Morrison from church was actually a retired pediatric psychiatrist who'd lost his license 5 years ago for inappropriate prescribing practices but had managed to keep seeing private patients through some legal loophole. Their choice of mental health professional told me everything about their commitment to actual help. "We're not trying to shame you," Mom added, though her presence suggested otherwise. "We just want you to get real help for whatever's causing you to need this much attention and sympathy." The attention and sympathy had consisted mainly of concerned texts that I was too tired to answer and offers of help that I was too proud to accept. But they'd reframed my medical isolation as attention-seeking behavior in their shared narrative. "What bothers me most," Vanessa continued, "is how this affects family events. My engagement party, my bridal shower planning, Mom's birthday dinner. Everything gets overshadowed by Emma's supposed medical drama. Every family event I'd missed had been due to chemotherapy schedules, recovery periods, or immune system suppression that made public gatherings dangerous. But they'd interpreted my absence as strategic manipulation rather than medical necessity. My phone buzzed with a text from Dr. Williams' office, confirming my 10 a.m. appointment and noting that she was looking forward to meeting my family members who'd requested to attend today's session. Vanessa had unknowingly requested exactly what she claimed to want: direct access to my medical team. "I've cleared my morning," Vanessa announced proudly. "I'm coming with you to this supposed appointment to meet these doctors who've been enabling your fantasy. When they realize what's really going on, they'll refer you for appropriate psychiatric care." Mom nodded enthusiastically. "It's time for some accountability. Real doctors would never have let this elaborate story continue for so long. They had no idea that real doctors had been documenting their behavior for months, that my treatment team had been professionally appalled by the family dynamics, and that Dr. Williams had been particularly interested in meeting the relatives who'd been undermining her patient's treatment compliance." "Fine," I said, gathering my purse and medical folder. "Let's go meet my oncology team." Wednesday morning was about to become the most expensive education they'd ever received. Revelation, 400 to 600 words. Dr. Sarah Williams entered the consultation room at University Medical Center with the commanding presence that had earned her recognition as one of the top gynecologic oncologists in the country. At 42, she moved with the confident efficiency of someone who'd spent 2 decades saving lives and had little patience for situations that compromised patient care. "Good morning, Emma," she said warmly, then turned to address my family with clinical assessment. "And you must be the family members who've been questioning Emma's diagnosis. I'm Dr. Williams, Chief of Gynecologic Oncology." The silence was immediate and complete. Vanessa's confident smirk faltered as she processed that we were sitting in an actual cancer treatment facility, facing an actual department head who clearly knew me by name. "I understand there's been some confusion about Emma's medical situation," Dr. Williams continued, opening the thick file that contained 6 months of my treatment history. "Let me clarify a few things." She spread the first set of documents across the consultation table with surgical precision. "These are Emma's pathology reports from her initial diagnosis. Stage 3 high-grade serous ovarian carcinoma with peritoneal metastases." Mom stared at the medical terminology like it was written in a foreign language, which for her, it essentially was. "This is her surgical report from her debulking surgery," Dr. Williams continued, producing more documentation. "Followed by her current chemotherapy protocol, 6 cycles of carboplatin and paclitaxel, administered bi-weekly through her port." She gestured toward the port access visible under my shirt collar, the medical device that Vanessa had somehow never noticed despite months of scrutiny. "Emma's treatment response has been excellent." Dr. Williams' voice grew colder as she reviewed her notes. "However, her psychological distress scores have been concerning due to what she's described as complete lack of family support during treatment." Vanessa found her voice, though it came out much smaller than usual. "But she never looked sick enough. And we never saw her at the hospital." "You never saw her at the hospital because you never visited," Dr. Williams replied with the particular tone oncologists reserved for family members who'd failed their patients. "Emma has been receiving treatment at our infusion center twice weekly for 6 months. She's invited family members to attend appointments multiple times. All invitations were declined." She opened another section of the file. "Furthermore, Emma's financial stress has been documented as affecting treatment decisions. She's delayed imaging studies due to copay concerns while simultaneously providing financial support to family members who questioned her diagnosis." Mom made a small choking sound as she realized the implications. "As her primary oncologist," Dr. Williams continued with professional displeasure, "I've rarely encountered a case where a patient's own family has so actively undermined treatment compliance and emotional well-being." She pulled out the final set of documents, imaging studies that showed the clear progression and response of my cancer to treatment over 6 months. "Emma's 5-year survival rate with completed treatment is 78%. Dr. Williams concluded. "Without treatment, her life expectancy would have been measured in months. The fact that she's maintained excellent treatment compliance despite family hostility demonstrates remarkable resilience." Vanessa was staring at the PET scans showing actual cancer in actual organs, her face cycling through confusion, horror, and dawning realization that she'd been medically wrong about everything. "I've documented the family dynamics affecting this case extensively," Dr. Williams added, closing the file with finality. "It's been professionally disturbing." The consultation room fell silent except for the sound of Vanessa's engagement ring hitting the floor as her hands began to shake. Dr. Williams concluded the appointment by providing Vanessa and Mom with comprehensive educational materials about ovarian cancer, family support during treatment, and the psychological impact of medical denial on patient outcomes. Her professional recommendation was clear. They needed immediate counseling about supporting cancer patients, or they needed to remove themselves from my support system entirely. The aftermath unfolded with swift and devastating precision. Vanessa's fiancé learned about her cancer diagnosis expertise when the story spread through their social circle. Turns out, publicly questioning someone's cancer while they're paying for your wedding creates significant relationship trust issues. The engagement lasted another 2 weeks. Mom's Bridge Club disbanded after members learned she'd dismissed her daughter's stage 3 cancer as attention-seeking behavior. Her volunteer positions at the hospital auxiliary became untenable once word reached the medical community about her family's behavior. By the following Monday, the financial support structure they'd built around my income collapsed completely. The wedding venue deposits, dress payments, and lifestyle subsidies I'd been providing disappeared along with their credibility. Difficult to ask for money from someone whose cancer you'd called imaginary. Vanessa's social media posts about family drama and attention-seeking behavior became permanent digital evidence of her medical judgment. Future employers, potential partners, and social connections would find a detailed record of how she'd responded when her sister had cancer. I completed my treatment 4 months later with Dr. Williams' team celebrating every milestone. My 5-year survival odds improved with each clean scan. My family relationships, however, remained in terminal decline. The Wednesday morning consultation photos, taken for medical documentation, captured the precise moment when medical reality educated a room full of amateur diagnosticians, when a department head silenced years of willful ignorance, and when 2 women learned that questioning cancer had consequences. Dr. Williams had done more than defend my diagnosis. She'd provided legal documentation of family behavior that would follow them through our community indefinitely. Some relationships don't survive medical reality. Some people don't deserve to. I spent the holidays with my treatment team and fellow patients. People who understood that surviving cancer looked different than expected, and that real support came from those who believed you when you said you were fighting to live. The truth had its own timeline, and Wednesday had arrived right on schedule.